Beyond the urban sprawl and gleaming city lights, communities like Sitio Bebe exist, often unseen, yet profoundly impacted by the environment. Today, we delve into the realities of life within Sitio Bebe, a community facing unique challenges right here in Manila.
Living in Sitio Bebe is difficult. They don't have proper roads, and during rainy season, they struggle. Their homes are very close together, and sometimes there's not enough clean water. These conditions are often a result of rapid urbanization and informal settlements. Limited access to basic infrastructures like proper sanitation, waste management, and drainage system creates a cycle of environmental challenges. Overcrowding further exacerbates these issues, making daily life a constant struggle against the elements.
The risks facing communities like Sitio Bebe extend far beyond daily inconveniences, with overcrowding amplifying the spread of infectious diseases, stagnant water from poor drainage, breeding mosquitoes that carry dengue and malaria, and prolonged exposure to contaminated environments, increasing risk of chronic conditions like gastrointestinal disorders and respiratory diseases, all of which deepen barriers to education, employment, and long-term prosperity.
The harsh living conditions in Sitio Bebe have a profound impact on its residents, from the constant threat of flooding to the lack of safe public spaces. Every aspect of daily life is affected. It shapes their routines, limits their opportunities, and often dictates their well-being. If it continues being unaddressed, environmental challenges in informal settlements create cascading health risks. Unsafe water sources fuel outbreaks of cholera and typhoid. Unmanaged waste attracts pests that spread infections. And cramped living spaces make it nearly impossible to contain illnesses like influenza or tuberculosis. While limited access to healthcare means minor conditions often escalated into life-threatening crises that strain both families and local medical systems. These environmental factors contribute to a heightened sense of vulnerability. Basic tasks which others might take for granted become significant hurdles. The continuous exposure to unsanitary environments can, can also lead to long-term consequences that, that extend beyond the physical, impacting mental and social well-being.
Perhaps the most critical consequence of these living conditions is a direct threat of their health. Residents of Sitio Bebe is disproportionately susceptible to a range of illnesses. The lack of proper sanitation and clean water makes waterborne diseases a constant concern. Respiratory illnesses are also prevalent due to poor air quality from open burning and dust. Skin infections are common in areas with inadequate hygiene and water disposal. These health challenges not only cause suffering but also create financial burdens, trapping families in a cycle of poverty and illness. Understanding these conditions is the first step towards finding a sustainable solutions and supporting the resilience of the communities like Sitio Bebe.
Addressing this crisis require collective action from local governments, nonprofits, and private sectors to invest in scalable infrastructure upgrades, establish community-led health and sanitation programs, and create pathways to secure housing, ensuring that no community like Sitio Bebe is left unseen or unsupported as Metro Manila work towards a more inclusive and resilient urban future.